Well, good morning, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan, with perhaps the worst possible name for a podcast. Again, you'll find me always, if I could change it, I would, but too late now, ship has sailed. Okay, I want to talk to you today about the microbiome and basically, what people really don't understand what the microbiome really is. I think that's a big, big issue. I mean, it's a topic you hear about, but you really don't understand uh, how important it really is because there's a lot of health related issues that basically you're going to get treated for a symptom, but where the cause is, and the cause in many cases today are from a leaky gut. What happens is around your intestines, you have a covering, just to keep it really simple. And this covering keeps the bacteria, the viruses, everything inside your digestive system. And what happens is when the covering opens up, a lot of bad stuff leaks out. Okay. Um, I just read something about well, I kind of read about it several times. The linking of Parkinson's. Um, what happens? You have these things called lipopolysaccharides, which is a very complex term that I really won't go into, but these LPS, lipopolysaccharides, go up the vagus nerve and can go actually past the blood brain barrier and help contribute to Parkinson's. So I think in the future, you know, nobody really knows what's causing Parkinson's. They're looking for a drug. Well, if you get a drug that treats the symptoms of Parkinson's, which listen would be fantastic, I don't doubt that. But what would happen is you're not going to have that. You're attacking the symptom of Parkinson's, which is a progressive disabling, ultimately will cause you to die type of a pathology. I mean, it started up with terrible ones like Alzheimer's and Lou Gehrig's ALS. So you have all these different things. So basically, the microbiome is a complex system within your body, and it protects the body and makes it a little bit healthier. So it's a collection of microorganisms, and it calls your digestive system its home. So what you have going on is bacteria are in there, fungi, viruses, other microbes, and they all play a crucial role in supporting your immune system. What they do is they aid digestion, they regulate metabolism, and they even go so far as influencing your mental well-being. So it's kind of becoming more and more important. I mean, yes, you need your vitamins, your vitamin C, vitamin D, your fish oils, all that's still important. But protecting the microbiome, which is basically under siege these days, is even of more importance. I mean, here's a couple of steps you can take. First of all, if you get a balanced diet, you know, you know, fiber, fruits, vegetables, fermented foods. Fermented foods are really, really big, um, beneficial. It's like almost like a probiotic in itself. Um, so what you have is, so again, fiber, fruits, vegetables, um, organic meats, fish, all that stuff is much better to keep the diversity of the bacteria within your intestines, within the microbiome. Let's call it the microbiome instead of intestines. And we'll leave it at that. It's a little bit easier. Now, probiotics are these beneficial bacteria that, sometimes people take a probiotic after they're on an antibiotic. Now, listen, if you need to take an antibiotic, you need to take the antibiotic. There's no question with that. But what I want to point out is the probiotics will give your body a chance to restore. And, they kind of keep a healthy balance. The pH in your intestines or within the microbiome is very important. When it's off, you're more likely to get sick or develop different disease processes. So you really kind of want to keep probiotic will help, kind of keeps the bacteria in check in your, because you need the good bacteria to balance out the bad bacteria, and keep the viruses in check, to keep the fungus in check. And there are certain foods you can, like one of the popular ones, like stuff like yogurt, fermented foods, sauerkraut, kimchi, kefir. These are all probiotic rich foods that you kind of supplement with on a natural basis. Um, Prebiotics is a type of fiber that feed the good bacteria in your gut. So this is really, really important. Um, And some of the foods that I would like to start, your onions, your garlic, bananas, asparagus. Um, so all of these help feed, because you got to feed the good bacteria in a sense. Again, overuse of antibiotics is another thing that you really got to be careful of. Too many antibiotics are not good. Been overprescribed. I mean, if you can get away without it, but listen, if you need it, you need it. I'm not going to tell you not to. And the other thing too is chronic stress is going to affect the microbiome. Um, so, like anything else, your whole life is going to be better with exercise. Meditation, getting enough sleep, um, probably supplementation. So let's talk about that. One of the problems I've always encountered is, and for that reason, I really don't stock and sell vitamins and stuff in the office. I'll get them for people. I believe in them, but I don't want to sell stuff. It's just counter to what I like to do as a practitioner. I mean, some places you go in, you leave with a bag of vitamins. I'd rather tell you which vitamins to get or get them for you, but I'm not really keen on selling vitamins. Now, having said that, there is a particular company who put out a product called Megaspore. And Megaspore, and I really cringe like trying to tell you about this, but I do not know. You can't just call up and get Megaspore. I mean, maybe you could. I just don't know where. And there's a program they put you on. It's like a 3 month program where you would take a something to build up. So the first thing you take is the mucosa. The mucosa is the covering that you want to build up. So there's supplements it's a powder actually. I'm looking at it right now that helps heal the covering, mucosal covering. Mucosa, like mucus, that covering helps protect and lock in the cell wall of the microbiome. So that's a support. So it's a three things. So it's not like a really complicated thing. And if you're going to take any vitamin supplements today, I would say you would do this one. And so it's basically down to three different things, which is not that hard to take. One's a powder to build up the mucosa. Another one is the prebiotic, which again it feeds. You have to support the good bacteria, and basically the megaspore is the good bacteria. And so it's a rather simple way for you to know that you're doing probably as much as you possibly can, and for the microbiome, because you get all these crazy symptoms, thyroid, gluten sensitivity, um, autoimmune diseases. There's so many different things going on. You got your Parkinson's. I'm not saying if you get Parkinson's, this is this stuff is probably a little too late to try to take, but it is damn good stuff to take, and it's a good protective mechanism for you to stay healthy. And I would say it if over anything at all, make sure your microbiome is safe, because you can always eat better as well if you can't say you can't afford supplementation. Well, in this case here, you really need to get yourself um, on a regular basis. Get yourself going with the good stuff. I mean, there's a couple of points I really don't want to go because I got off on the chronic stress and getting into it. Believe it or not, disinfectants, overuse of household disinfectants can also harm the microbiome. I mean, everything is antibacterial soap, antibacterial, mouthwash. You need to taper this down a little bit. It's you know what I'm saying? It's a little overkill. You know, all bacteria aren't necessarily bad, and when you use antibacterial soap, antimicrobial soap, you're killing the good bacteria as well. So it's a little bit overkill. You want to have some kind of a tolerance to bacteria, but if you have a healthy microbiome, anything in there is going to get locked down and excreted out. So that was one thing. This is an important thing: is breast milk really helps colonize the infant's GI tract and support the development of a healthy biome. So breastfeeding it contributes to a robust microbiome community in infants. And let's face it, infants have a lot of time issues with formulas and stuff like that. So it just is definitely a very good thing. So let's put a summary up here. By protecting the microbiome, here's what it helps. Okay, you keep it healthy and diverse. It aids in digestion and nutrient absorption. Okay, Nutrients are absorbed through the intestines, and so, but you want to keep the bad stuff in and the good stuff to get out. It supports a strong immune system by fighting off pathogens, and it helps produce essential vitamins and enzymes as well. Now, the microbiome can also help regulate metabolism and weight, and also influence mental health and brain function. So, a poor diet can lead to mental illness. I know that seems like a real stretch, but stress, poor diet, it affects brain function just as much as lack of sleep does as well. So, and a good microbiome can help. I'm saying help not because certain like allergies, obesity, inflammatory bowel disease. Like I said earlier, good to take if you want to potentially ward off Parkinson's. I mean, there isn't the Parkinson's thing scares me because I see it firsthand, and I see more and more younger people coming down with it. So, what is the big takeaway? Well, in conclusion, I mean, it's like protecting your microbiome. You can support it, your immune system, and allow it to function optimally. All right. I mean, I think that's I think that's really important. I think it's critical, as a matter of fact. So, Dr. Brian McKay, not just a chiropractor. I mean, there are a lot of health issues we have to deal with. Obviously, I don't treat any of these diseases like Parkinson's or allergies or you know bowel disease, but common sense would say at this point in time, you probably need to be on a regimen. And again, the Megaspore Biotic is a really pretty darn good one because and it's fairly reasonable in cost, which is something else too. Because I don't like to present stuff to patients that are crazy expensive, and I choose not to profit for these either. So I get them as a courtesy or as a service to my patients. So you need to reach me 203 656 3636. 203 656 3636. I'm Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Have a great day. Thank you.